Hello, everyone, and welcome to the ACRM Complementary and Integrative Networking Group for advancing the role of integrative health and rehabilitation medicine. My name is Matt Erb, and I am a physiotherapist located out of Tucson, Arizona. I am a co-chair of our webinar series, Hot Topics in Integrative Rehabilitation Medicine. So welcome. I'd like to first, before we introduce our speaker, introduce my co-chair, Dr. Peishan Wen. So Peishan, would you like to introduce yourself?
Sure. I'm Peishan Wen. I'm associate professor at the Occupational Therapy Department in Georgia State University, located in Atlanta, Georgia. Our speaker today is going to be Amita Nathwani. The topic for today is Ayurveda's role in rehabilitation. We will have a full introduction for Anita and just a moment, but before we started, I want to advise you this meeting is being recorded. So I'll ask everybody to keep your phone and mic muted. We do expect to have 5 to 10 minutes at the end of the webinar. So if you have questions, please type them in the chat box. We will address your question as many as possible. And also one additional tip is you can use the sliding bar to adjust your screen between the speakers and the video feed. That's all the housekeeping. So with
Great.
that, let's go ahead.
Thank you, Peishan. So, and with that, it's my pleasure to introduce our guest speaker. Amita Nathwani is an Ayurvedic practitioner who serves as a provider, teacher, author, and faculty member at the Andrew Weil Center for Integrative Medicine. With her psychospiritual approach, she embraces Ayurveda's role in healing by considering the intricacies of all of life's circumstances. She began her educational journey at the Maharishi School of Ayurveda and Sanskrit Studies in Bangalore, India, and continued at the esteemed Maharishi International University in Fairfield, Iowa. In 2003, she graduated with a master's in Ayurveda and has been dedicated to bridging the gap between traditional practices of Ayurveda and their clinical applications to serve others towards a holistic approach to healing. In addition to her clinical practice, Amita's passion lies in integrating Ayurveda and lifestyle medicine into medical school curriculums worldwide. We look forward to your talk, Amita, and will now turn the presentation over to you.
Thank you so much for having me. I appreciate that. Before we begin, thank you everyone for joining and, really delving into the world of Ayurveda. It's so vast. And generally when we have topics of discussion related to Ayurveda, it's a little tough because we're taking 5,000 years worth of medicine and we're honing it down into, a singular application. And the purpose today of this is to talk a little bit about why it is that we cannot necessarily take one treatment protocol and apply it into one specific ailment. And the reason is because Ayurveda is so encompassing in what it is that it takes into consideration the aspects of who we are as human beings, not only from what our ailment or injury might be, but our genetic predisposition, our constitution, which I will go into in quite depth here today, and also, where the climate in which we live in and the choices that we make throughout our entire life. And so it impacts us not only from a physiological level, but also to an emotional, and then ultimately the most important, which is a psychospiritual perspective, which is really important as providers that we look at, because that right there can tell us how the patient sees themselves with respect to their own health. And understanding that thread that underlies the current of Ayurveda really then brings forward why it is that we do what we do. It's really in the best interest of the patient and ensuring that everything that we're doing for them is taking into consideration all that they are. So without further ado, I'll start sharing my slides with you to give you a comprehensive understanding of how we approach Ayurveda in rehabilitation. So let me go ahead and make sure. All right, there we go. So, when we start looking at Ayurveda's role in rehabilitation, the first question is, what is Ayurveda? And although I gave you sort of a bird's eye view perspective, I wanted to get into some of the more specific details of what that means. So Ayurveda is considered a whole systems approach to health. So what that means is it is not specialized in one area or the other, although we have specialties in Ayurvedic medicine that I'll highlight next. It addresses the physical, the structural, emotional, mental, and spiritual aspects of a person. So we're talking anatomy, physiology, and of course, mental health is a huge component. Balancing all of these aspects of a person determines how their health will be determined. So even if, for example, we have someone who has a physical injury, that does not mean that they are void of disease, disorder, or imbalance in other aspects of their life. One could lead to the other. And we see this so much just in terms of stress and how it can perpetuate systemic inflammation throughout the body, or how one can have debilitating pain and how it can affect so many other parts of their life. Inflammation is also a really great example of how inflammatory disorders can lead to physiological inflammatory disorders and vice versa. Ayurveda values prevention and maintenance of health through diet, lifestyle, and psychospirituality. And these are really the building blocks when we talk about Ayurvedic medicine. So when we address a patient, we're not only asking them what is happening with them in that moment, but it's critical that we address their overall lifestyle and day-to-day living, what even their home life is like, in order for us to really fully assess what we can do to help them. And finally, the treatment of disease is not only determined by the manifestation of the etiological and pathological factors, but by the nature of the individual who the disease has occurred in. So what does that mean? Like, how not only are we considering that individual person, but from an Ayurvedic medicine perspective, each individual person also has tendencies. And before we get into those tendencies, I wanted to head into the understanding of the 8 branches of Ayurvedic medicine. So every Ayurvedic physician specializes in each one of these. There's further specialization if you choose to go into this area, but understanding all 8 of these aspects can then help us providers help the patient better, because each area has its own unique perspective on how it's addressed. So when we look at physical injury or physical rehabilitation, that's included in internal medicine, but its treatment protocols may be surgery, which is not known to many, but surgery actually has been in Ayurvedic medicine for 5,000 years. The surgical techniques that were used at that time were more parasurgical techniques, addressing glaucoma, polyps, and also in modern medicine today, the grandfather of plastic surgery is an Ayurvedic physician by the name of Shushruta Sangita, and he was the first to develop skin grafting. ENT and ophthalmology, pediatrics, toxicology, OBGYN, geriatrics, and psychiatry. So some of these treatment protocols that we have will still be addressed in these specialties, but Ayurveda mostly addresses them through internal medicine and the understanding of the whole body and the system. So that's a little bit of a perspective on how Ayurveda is actually studied and how it's broken down into the branches. So now I want to discuss a little bit about when we're addressing a patient and we're looking at all of these factors, the etiological and pathological factors, we're also including something that we call a dosha, and that is a person's individual constitution and the way in which they are manifesting themselves in the world. When we start to look at individuals in this way, we can really start to observe that there are patterns, there are tendencies, there are ways in which we can assess patients to see what do they look like, how do they walk, what is their gait, what is their speech mannerisms, and all of these factors together will help us determine what their particular constitution is, and then we can start to better understand why a disease or a disorder has begun in the first place. So in order to do that, I do need to get back to the fundamentals of learning about these particular doshas in terms of the 5 elements. So Ayurveda breaks it down. There's entire philosophical books written about these 5 elements. There's theories that state that in this world, there are only the elements, and everything else that exists are just combinations of that or our perception. So the 5 elements from an Ayurvedic perspective are air, ether, water, fire, and earth. And not unlike traditional Chinese medicine, where 5 elements are also considered, traditional Chinese medicine uses metal and wood. But in terms of how they manifest in the body, surprisingly, we find such great similarities in the way that we speak about the elements and their impact on the body. So when we put air and ether together, what we're really doing is we're talking about this in terms of how the body actually has functionality or movement. So this determines everything from circulation, respiration, elimination, musculoskeletal movement, and even the space between the cavities. So air, being a light moving element, can also create a little bit of dryness when it moves quickly, and also has a cooling effect. So it can be variable, cold, and dry. And we call this vata, V-A-T-A, vata. So when we all have vata in the body, and that's something to keep in mind, because although we have tendencies more in one direction or the other, you'll note in particular that we may find patients who tend to have more circulatory issues or stiffness in musculoskeletal movement versus inflammation in musculoskeletal movement. So the next one is fire and water, and fire and water together create more of a conversion. So this determines everything from metabolism, digestion, production of enzymes, production of hormones, conversion. And this is called pitta, P-I-T-T-A, pitta. And the qualities related to fire and water, as you can imagine, the fire is hot, with water combined, it's damp. It also can be very sharp. So when we talk about sharp, debilitating pains, anything that creates that excess inflammation, we're referring to this pitta quality in the body. And remember, we all have circulation, respiration, elimination. We all have metabolism, digestion, and production of hormones and enzymes. And then the last one is water and earth together. And water and earth, when they come together, it determines the actual literal structure of the body: bones, muscles, tissues, tendons, structure, fluid, mass, organs, the actual musculoskeletal system versus the movement of it. Everything in the body that's a structure, including tissues, this is called kapha, K-A-P-H-A. And as you can imagine, water and earth coming together creates a very cool, not cold, but cool, damp kind of effect, or a wet effect, very dulling, because it's a mass, a literal mass. So we have all 3 of these within our physiology. We have it within our body, we have it in our mind, we even have it in our unique digestion. All of these things have to exist. But as I mentioned earlier, we have a tendency toward one predominance versus another. And so when we start to break it down into the individual doshas, vata, pitta, or kapha, we can start to see how we can assess patients based on whether or not this is a predominance for them. So in their nature, People who have a tendency toward being more vata predominant have a thinner physique, they're flexible, not very non-symmetrical in their facial features. They tend to be lanky, even if they're short. Tendency toward cold, dry skin and nails, variable digestion, small channels, literally meaning, the inability for the body to remove infection throughout the channels of the body quickly. So smaller ear canals, smaller eustachian tubes. You see the small facial features, a paler skin. They're very artistic, imaginative. They can think outside the box. They don't like to have too much spicy food or anything that's too heating in their digestion because their digestion is so variable, but they enjoy snacking, eating smaller meals. So this is when someone is in balance. You start to see these things, these qualities within them. And it's not an out of balance characteristic, but people who are vata by nature tend to have an imbalance more likely in their own dosha than any other dosha. So prakriti means their balance and vikriti means their imbalance. So the imbalance then could happen when that vata quality is taken too far. Instead of just being naturally thin, they're malnourished. They become rigid or too flexible. So the highly flexible patients that we see, patients with ED in particular, they tend to be more vata in their nature. You can see it in their personality. You can see it in the way that they walk, the way they talk, but also it can create a little stiffness as well. So they tend to have this without having a lot of strength. So they can be very flexible, but have a tendency to throw their back out or pull a muscle very quickly because they don't have a lot of strength to carry that. It's not within their nature to build muscle mass quickly. They have poor circulation. You could see it on their nails and hair being a little brittle. And again, as I mentioned earlier, tendency toward channel infections, grayer skin, presenting with anxiety and nervousness. I don't know what's happening with me. I don't know how to proceed. They do tend to have constipation and they forget to eat and take care of themselves, which then can lead to further debilitation in the body, and of course tendency toward nervous system disorders. So we even start to see that patients who have a history of dementia or Alzheimer's in their family, we look to see if they tend to have more of these vatic tendencies within them and if it has perpetuated throughout their life. So then what kind of treatment can we do when we start to see these vata elements rise up? So before I get into the treatment, keep in mind, as I'll mention with every single constitution, is that even if a vata person presents, even if somebody presents with all of these imbalances of malnourishment, rigid or too flexible without strength, et cetera, even if that's the case, it may not necessarily mean that they are vata by nature, but it does mean that vata is the imbalance. So everyone can have a vata pitta kapha predominance and everybody can have a vata pitta kapha imbalance. And it's not always determined by the predominance of the constitution, but more than likely we start to see people go in the direction of whatever their natural constitution is. So what we would do is if we start to see some of these treatment protocols as a general are always to remind the patient to have consistency and routine, warm, moist temperatures, heating, medicated oil applications, building large muscles. They inherently build their smaller intrinsic muscles. So building the larger muscle groups is important for them through strength building, regular meal times, high fat and protein intake, reminder to avoid multitasking as it does perpetuate nervous system disorders, developing a good sleep routine, even simple things like planting the feet on the ground, both physically and emotionally, because air and ether is so high up in the clouds. And remembering then when we do approach vata patients, it's critical that remember to not approach them with limitations. If I were to tell a Vata patient of mine to do the exact same exercise every day and also to eat the same food every day, they would never come back to see me because they are so outside of the box. They have wings. They literally want to fly. And although we help to continuation with that within them, we also need to make sure that we pull back a little bit so that then we can help them get balanced and stay grounded. And this is how Vata manifests in the body and the mind, both in a balanced and imbalanced way. So similarly, we look at Pittas, those who are more Pitta in nature, Pitta predominance. And they tend to have more of a lean physique. So meaning that they can build muscle definition. And I don't mean bulking up, but really getting very cut and lean. So as Vatas go to the gym and work out, they have a tendency not to be able to gain as much muscle definition or as much strength as Pittas do. And Pittas tend to also be very athletic in their nature, and they enjoy having a lot of that linear strength. So they will do a lot of cross training through rowing, riding their bike, running. These are all activities that Pittas enjoy. They tend to have symmetry on their face. It's a good way to be able to see and determine whether or not someone's Pitta by nature, and a tendency toward hot, oily T-zone. So not necessarily oily throughout the body, but mostly you can see it on their face. They have a very strong digestion. So, and they like programs. They have increased blood flow, meaning if you were to look at their forearm, upper arm, you could see the veins flowing through. Sharp facial features, redder skin, very logical, very precise. They're the patients that walk in and say, give me the program, I will follow it to a T, and let's make it happen. They have the ability to solve problems quickly, and they convert energy quickly as well. So they do have a tendency toward hypoglycemia. They eat routinely and they enjoy spicy food. So when they are not in balance, they tend to be burnt out. They have a burnt out physique, burning the candle on both ends, so to speak, and lack of flexibility, both physically and emotionally. So a lot of Pittas don't enjoy building flexibility in their body because they're busy being very athletic in their symmetrical types of activities, the sports that they do. Excess heat in the body, hot, dry skin, obsessive, argumentative. They also can have addictions because of their obsessiveness to something physically and emotionally. Hypoglycemic, as I mentioned earlier, and tendency toward inflammatory disorders, looser stool, heart disease, and increased stress. So what do we do when we start to see these things? And again, inflammatory disorders can exist in anyone. It doesn't have to be someone who's Pitta by nature. A Vata person or a Kapha person can actually present with this type of vikriti or imbalance. So what we do in these cases is less aggressive treatments. The more movement, the more activity we have, of course, we're going to be building a natural inflammatory response in the body. So we want to have a less aggressive treatment with those who want the more aggressive treatments. Support the patient having patience with themselves as they go through rehabilitation, and using cool or colder treatments. So this is post-acute stage, but this is overall in general. We recommend keeping that inflammation down as a general rule. Cooling medicated oil applications, and I'll be discussing that a little bit later in terms of what we do with topical medicated oil applications for injuries. Swimming is great, less spicy food, slowing down with competition, meditation to cool the mind, less of the linear sports, more dancing. What a concept. They can be a little bit more free flowing and allow themselves to not necessarily be stuck in a structure. Fewer carbohydrates because their blood sugar tends to drop quickly, and they have hypoglycemia. To eat regularly so that they don't drop their blood sugar and get hangry, reduce stress, walking as a form of exercise, and support experiencing the body instead of studying it. I oftentimes have my patients who really just want to know what they need to do. And this is helping Pittas really develop their intuitive understanding of their body is important. Asking those questions, do you feel what we're doing here? What is your perception of how does it make you feel? These are really important questions to ask someone who's more Pitta. And always approach the patient with facts and studies. Vatas, they find their self-realization through non-attachment. Pittas find their self-realization and happiness and growth through knowledge. So this is how we address people who tend to have either more Pitta in nature or they present with more inflammatory disorders. And then last, of course, we have Kapha, Kapha as it manifests in the body and mind. So keep in mind, Vata is more of the air and ether element. Pitta is more fire, and Kapha is a tendency toward these patients being more grounded and to the earth. So Kaphas tend to have a larger physique, more rounder joints, more robust. They're the ones who can go to the gym and work out, and they bulk very quickly. They have a tendency toward cool, oily, like damp skin, very steady digestion, round facial features, thick skin, hair, and nails, very emotional, soft, compassionate, mental stamina, reliable, steady, and consistent. So you can always tell a Kapha patient where they slow and steady wins the race very easily. They just show up, they do their work, and they go home. I generally find it's difficult to get Kaphas even in to see providers for self-care, because it's harder for them to like literally move from point A to point B. So oftentimes we find the Kaphas to be the more challenging in terms of getting them to move. But Kaphas are the kind of patients that once they find something that they love physiologically or from as a sport, then they're committed, they're all the way in, but actually getting them to commit to something in the first place is a little difficult. Not because they are flighty or have a tendency to waffle back and forth, but just simply because it takes them a long time to develop a healthy routine or regimen for themselves. So when out of balance, they tend to be more obese and sluggish, and fluid buildup in the joints, cold and damp digestion. We can see growths on the body, overly emotional, wet constipation, stubbornness, fear of change, eating many large meals, tendency toward disorders that slow down the body. So sluggish gallbladder, hypothyroidism. So how do we treat these patients? So keep in mind, everything that we're talking about here in terms of the imbalance is really quite indicative of the patient who has maybe increased weight. So obviously, this is not just directed toward those who are Kapha by nature, but anybody can increase weight. Anybody can have fluid buildup in the joints. Anybody can get sedentary. So treatment protocols, we have our high cardiovascular exercise and stimulating medicated oil applications, developing intrinsic muscles. So if we do have a Vata patient who naturally can build those intrinsic muscles, has them, but isn't building their large muscles, but they have gained weight. For example, they've become Kapha in their nature. Do we then help them develop their intrinsic muscles? Yes, for a short period of time. For a short period of time, we help them do that. And that is so that we can reduce Kapha, but it is not inherently going to be their full program at all times. And so this is how looking at the imbalance can start with one treatment protocol and then move into something that's a little bit more long lasting in terms of prevention and maintenance of health. Support daily activities, so walking every day. doing an exercise every day, staying active, creating a variety of options with foods and activities to keep the patients out of a rut. So any type of exercise program, it can be done so monotonously by some that they're not really engaging again with the body and understanding what it needs. So keeping a variety going is really important. Encouraging spice in meals and keeping the quantity of size of meals small. So even if we're addressing a patient from a physiological level, it's really important that we address some of these more digestive components, because we know that the science is there. We've learned about the relationship between the gut and the hormones and how they affect us, not only in our moods and our emotions, but systemically throughout the body. We also encourage bitter greens and less saturated fats. It can create a heaviness in the digestion, and always with kaphas, we have to approach them with hope and gentleness, because they're likely to just never come back again if we're too harsh on them. So now that we've understood Vata, Pitta, and Kapha, ways that you yourself, based on everything that I have just showed you of what does a Vata person look like when balanced? What does a Pitta person look like when balanced? What does a Kapha person? You can look at this by assessing their facial features, their gait as well. Vatas tend to be lighter on their feet. They're always dancing everywhere they go. Pittas tend to be more linear, and kaphas are a little slow and steady with their gait as well. And these are also great assessment tools to be able to determine what needs to be done for the patient. Tongue assessment, it's a whole science, as well as pulse diagnosis, which is number 3 here. We did at one time look at urine and feces examination, regardless of what the ailment was. We look at mucous membranes, ears, nose, and throat. If there's excess dryness, we understand that there may be a Vata imbalance. If there's excess mucus, there could be a Pitta or a Kapha imbalance. Look at a patient's stress, their hair color every time they come in. Is it consistent? Is it variable? Their speech and mannerisms, do they tell you the whole story, or do they just give you a one-line answer on their intake forms? The time of arrival for the patient, there's some patients are consistently late. Vatas are all over the map, too early, too late. Pittas are on time every single day of the week. And the Kapha constitution tends to be just always a few minutes behind. I'm Kapha in my nature, and I always arrive somewhere 3 or 4 minutes late. And where they decide to sit, I have 3 places in my consultation room. Depending upon what your office structure looks like, you can always determine a constitution, at least from an emotional standpoint, based on where the patient chooses to sit. So I have one that looks out the chair that looks out the window. Fantastic. They can view the whole world. There's one that sits right in front of me. We know that those are Pitta patients. They are only there to see me with their paper and pen in hand. And then there's the Kaphas who sit as far away from me as possible in the corner, in a chair. They're there, they want to hear what I have to say, but they also just want to go home. And finally, asking questions, not only primary concerns, health history, family history, emotional state, diet, lifestyle, etc., but also what is their Ayurvedic constitution. So I put a link here. I have a dosha quiz that I recommend that everyone take for no other reason but for the purpose of self-education, self-referral. We don't pigeonhole ourselves. We don't put ourselves into a box. Once we do that, we find ourselves not being able to look at the nature of the person and their imbalance, or the nature of ourselves and our imbalances. We get pigeonholed into I am Kapha, I am Vata, I am Pitta, but we are all 3, and various components can increase or decrease over time based on so many factors, even where we live in the world, the climate in which we live in. Why do our joints hurt when it's about to rain? These are all really important things to ask ourselves, regardless of our constitution. And so if you get an opportunity, take a look at that link, and I'll be sure to add it as a link you can click on. And so when we talk about methods of treatment in Ayurveda, this is where it gets more applicable for the purposes of us today. So obviously we will talk about prevention in terms of diet and lifestyle. And again, we talk about in terms of their individual dosha. So maintaining a good exercise routine, what kind of foods to eat, these were all addressed a little bit in the Constitution. So diet, obviously we do, yoga is a huge component of Ayurveda, but we also have other forms of activity that we recommend, such as running and also martial arts. So Ayurveda addresses a lot of various ways that the body can stay active. Oil pulling, eye bathing, alkalizing the gut, medicated oils. There's so many aspects to day-to-day routine that we can help to keep the body grounded. Ayurveda uses a lot of oil therapies as a general maintenance, because what happens is that as we move, as we age, there's a natural deterioration of the body. Things become brittle, they change, vata increases. And so using oil therapies really helps to keep the body grounded. In addition, oils can be excellent carriers for any medication or herbs that we might want to use. We use curing therapies, so herbal recommendations, we call that Dravya Guna, and physical alignment. So we actually use yoga asanas as a way of helping the body get back into shape again. Purification techniques, so removing toxins from the body. And we look at this because one of the big things that happens in Ayurveda that we find is that the first few stages of the disease process can easily be addressed with diet, lifestyle, and curing therapies. However, once we get into later stages of disease, the body actually readjusts itself so that then the disease process manifests itself into a disorder that might be more in stage 3, 4, or 5. And once we get to that stage, it's harder to use these preventative tools in order to address the problem. So this is where Ayurveda really gets into purification techniques. And as you see, we have 5 actions of nasal therapy, vomiting, enema, purgation, bloodletting. And these purification techniques are used quite often in physical injury and ailment, because when a patient has become physically injured, the entire physiology changes in terms of its metabolism. And over time, if it's a larger injury, we need to help to reset the body back again. And in these treatment protocols, there's also a lot of manual manipulation through massage and oil therapies that are used quite extensively. And I have some studies linked at the end here to show you what that means. We oftentimes just classify diseases and disorders for the sake of helping us understand a little bit more of how Vata, Pitta, Kapha is found in the diseases and disorders that we're addressing. So Vata is more vitiation. So something like a hiatal hernia would be considered a Vata dysfunction. So the natural upward movement, downward movement, the natural course of how things function has been taken away. It could result in an inflammatory disorder, a natural inflammatory response by the body. That would be considered more Pitta. And then it also, at the same time, could cause an obstruction. And this is Kapha. So then when we address something like a hiatal hernia, we are addressing Vata, Pitta, and Kapha simultaneously if there is an obstruction there, so that then we can help to reduce all 3. Let's see here. So specific treatment protocols that I really like to talk about when we're talking about rehabilitation is, the first one is yoga asana. Yoga asana has been used for centuries, 5,000 years actually, in helping from a both kinetic and static movement perspective. So we're not only looking at it in terms of how do we how do we address the particular disorder by doing XYZ protocols, but we have to look at it as a whole system. We're not only strengthening the particular large and small intrinsic muscles of the body, but we're also teaching the body how to function in a different way. And these are usually what's used in the treatment of physical injury after the acute stage has been treated. So the acute stage is treated a little bit differently, and we do something called Abhyanga for that. So it's Abhyanga is literally translated as a self-oil massage. So these are herbal medicated oils that are administered locally and systemically for reduction of vitiation, blockage, or inflammation. So either Vata, Pitta, or Kapha. And these particular oils, what is used is if it is a vitiation, so there's a dysfunction in the movement, there's generally going to be some sort of constriction that occurs. So we want to recommend medicated oils and herbal therapies that create a little bit of dilation. If there's a blockage, we want something a little bit more stimulating so that we can start to move things through and maybe even be a little bit more vigorous with our manual manipulations and massages. And if there's inflammation, obviously anything that we provide is going to have an anti-inflammatory effect. As we mentioned earlier, detoxification is also a very large component. And in detoxification, before we can even get into doing those pancha karma protocols, we do something that's called purva karma, which really helps to stimulate the digestion. We can't even get into working on the whole body unless we've started to work on the digestion first. And this is a really critical component when we're even addressing physical issues, because the cleansing of the digestive tract will allow for better healing through the administration of herbs and nutrients from food. So we can't continuously address the physical problem without giving the body the ability to take in what it needs in order to help support the work that's been done. So sometimes we see patients who continuously come in to get fixed, but looking at the overall underlying, not just root cause, but how they're perpetuating the issue in the body is more critical than treating sometimes the issue. Because if it's only in the first couple of stages of pathology, then we can easily just revert back to management and prevention of disease. And then last, I want to address a couple of herbal therapies. When we address herbal therapies in Ayurveda, I'm mostly talking about in terms of pain and inflammation. There are other very specialized herbs that help to build more synovial fluid in the joint, or actually can help with the knitting of the bones. But for our purposes today, I just wanted to highlight a few classic herbs that are used in Ayurveda. And the first one is Baswalia, otherwise known as frankincense. So the research shows that it may be particularly effective at reducing inflammation. We oftentimes use Baswalia in place of NSAIDs. Some people like to use turmeric, but as we read a little bit more into the information, the turmeric can help reduce inflammation, but it doesn't help to build that synovial fluid, and it doesn't create a cooling effect in the body. In fact, turmeric in high doses can be very hot and heating for the patient. So oftentimes we, from an Ayurvedic perspective, use this in place of NSAIDs. Triphala is called three fruits, and the three fruits are Amalaki, Bibitaki, and Haritaki. Amalaki is oftentimes also used as a systemic anti-inflammatory. We actually use it for gout, fevers. So you can imagine it's more systemic versus getting into particularly the muscles, tissues, joints, etc. It functions, when all these three fruits are used together, it functions as a natural laxative, but it's very balancing for the body. Abdominal pain and flatulence, while improving the frequency and consistency of bowel movements with people with gut disorders. And as I mentioned earlier, that purva karma, that detoxification, is so critical when we're addressing physical pain, because it's recommended for the better absorption of anti-inflammatories in patients with sluggish digestions or obesity. So I oftentimes would recommend pairing Triphala with some other anti-inflammatory like Baswalia or turmeric. also keep in mind that dosing is critical, and Triphala taken in high doses can actually have the opposite effect. And then, of course, everyone's favorite turmeric, which we Ayurvedic docs are flabbergasted at the high dosages that are recommended for patients, and anti-inflammatory herbs supplementation. We caution to limit the dosage to 1,000 milligrams a day, as it can be very heating. And really, turmeric is it is fat soluble. And so from a traditional Ayurvedic medicine perspective, we cook with turmeric. We put it in ghee, we put it in oil, we're cooking with it, we're eating it. To take it on its own, it actually does not get absorbed as well. Hence, the recommendation of taking it along with black pepper came into use for a while, just so that, it can help to break that down. But really, if there was any supplementation that it could be paired with, it would also be boswellia, because boswellia does help to build a little bit of that mucous membrane around all the mucous membranes of all the organs of the body. And so, in the joints, in the cavities. And so when you pair boswellia and turmeric together, we do find that that can be a lot more effective than just using either one of them alone. So these are the common herbs that are used in Ayurveda for pain. Obviously, for today's purposes, I'm just speaking in generalities and not addressing any particular patient or disorder, but there are so many factors to consider that, as you can imagine, working through each one of these is really dissecting and getting to know the person and who they are and addressing them for the betterment of their health. So I hope this was a good opportunity for you to learn a little bit about how Ayurveda addresses Ayurveda's role in rehabilitation and how it addresses the person as a whole, not just from a physiological standpoint, but also from a pathological and an internal medicine perspective. So I don't know if there are any questions, but I'm open to taking any at this time.
Thank you, Amita. I am soaking this up, to borrow a mind body metaphor, digesting it. It's relevant to Ayurveda. One question that I'm sitting with is recognizing how contemporary science is often catching up to this type of age-old wisdom. And I'm wondering if Ayurveda has had a historical approach to the whole idea of microbiome and probiotics, and how they're finding that whole environment of the gut impacts other conditions, like even brain health. So I'm just wondering if you could say a little bit about that.
Yeah, absolutely. It is a little bit of a joke that we tell often, that when you go see an Ayurvedic doctor and you tell them what's going on with them, and they'll sit there and and then you say, and then my bowel movements, and suddenly everybody sits up and they're so excited, and the notes and the questions are being fired off. And we used to laugh about this a lot when we were in school, but the bowel movements are the storyteller of the body, and Ayurveda focuses on gut and digestion more than anything else. And although we didn't have the language at that time to discuss how the biome and breaking it down into the specific components of flora in the gut could affect brain health, we utilize that first and foremost when we're talking about mental health. It is the first treatment that's the first line of treatment that we go toward. And we do have particular, the reason we focus so much on the bowel movements is because they're the storyteller, right? They not only talk about what the patient has eaten, but also how they are digesting it, and then how it's being used to be moved out of the body, and talk about a whole understanding a person from top to bottom, the choices that they're making, the environment in which they live in, the way in which the gut biome is interacting with the food that they're eating. And at one time, looking at the stool was the first thing that we would do when we would see patients. So still today in India, if you go to some Ayurvedic hospitals, the first thing you'll do is you will have a bowel movement. They will look at it and do their assessment in that way. And so treatments that we use are very much geared toward helping the body produce its own pancreatic enzymes, breaking down food so that it's easier to digest, looking at the liver, gallbladder, and its relationship to the digestion. And we focus a lot on purgative and treatments that will allow the body to move the food clearly so that then we can replenish the digestion with good flora. And we use, what would be traditionally here called kefir and other probiotic types of foods, fermentation. We use that to help to bring the digestion back to health again. So even though we don't have the terminology that we do today in Ayurveda, it is always the first course of treatment for mental health.
Fascinating, and thank you. I'm also wondering if people are sort of new to this topic and taking interest, are there ways to partner or identify Ayurvedic professionals? We have an audience around the world of many different professions that'll be watching this. So just wondering if you have any general recommendations for how to seek out and support people through this wisdom.
Yes, absolutely. It's always been a tricky subject, because Ayurveda is meant to be for everyone. Anyone should be able to practice Ayurveda for themselves. So creating licensure or any type of certification around Ayurveda becomes very tricky when one wants to simply suggest to somebody that they take turmeric or boswellia. But the best way in order to really refer your patients to someone is, do a little research and find out what their level of education is. So I always recommend, postgraduate education, a master's and above, if somebody hits here in the United States, because doing an undergraduate degree in Ayurveda really addresses a lot of the prevention, maintenance of health, and recommendations that can be made for continuing on, like we talked about the disease stages, the earlier disease stages. As you start to work with physicians who have a master's degree or have some education in health sciences, you'll start to be able to see that they can address pathology a little differently. There's an accreditation called a BAMS. So it's a Bachelor's of Ayurvedic Medicine and Surgery from India. And these physicians have done the full training. You can find combinations thereof. So I'm a combination of the BAMS and a master's degree. So you can find combinations of those. Those are also really critical to ask and find out from the provider. So do a little research. If you find someone who's an Ayurvedic therapist or a health counselor, that they'll be able to give some good general education on day-to-day living in Ayurveda. And if you want to look at pathology, you want to get into more of a master's or a BAMS for that.
Wonderful, thank you. And Paishan, any questions from you or?
I have a lot of questions. This is like brand new for me. So like you said, I'm soaking all this information. So you mentioned about Ayurveda for mental health. Is there certain food that you would prescribe for people? They have like anxiety, get nervous easily. Like I have students, they have like tests, they will be like super anxious about it. Is there something that I can suggest them that you can eat certain food to kind of cool down a little bit?
Yeah, that's a great question. And although it won't resolve, the anxiety, because there's so much there, right? There's a lot to discuss. But in terms of diet, absolutely, there are some protocols and some supportive things we could do. So, for example, when we talk about anxiety, and we're not talking, we also very much specify what anxiety and depression look like together, and they can be different sides of the same coin. So anxiety that presents a little bit more as like a debilitated nervous system, the physiology, tremoring a little bit, indecisiveness, fear, that type of anxiety, we consider it to be more vata by nature. So these vatic components seep into the body, and they can happen to any of us. We can all become anxious. Somebody who's kapha can get up and do a presentation. They've never done one before. There's fear, there's anxiety, that type of vata disorder, because there's a change going on within them. So for them, we want to recommend grounding foods, and there's a healthy approach and there's an unhealthy approach. So I like to tell this story because I think it's very prevalent for all of us who experience things in our life. I don't have a lot of vata in me, but I had a loss about 10 years ago. My husband passed away, and I became very vata. I was nervous all the time. I didn't know what was going to happen next. Every step I needed to take, I would forget why I would drive somewhere. I would look around. I would move from room to room and not know where I was going. A big change had happened in my life. So vata increased and created a lot of that mental anxiety. So what does somebody in this situation normally do? They gravitate toward ice cream and pie and foods that literally get macaroni and cheese, all the comforting foods, even foods from my childhood then suddenly became the best thing in the world, but all the heavy, the fried bread and potatoes. And I was craving all of those things just to create a groundedness because anxiety had kicked in. But there are healthier approaches. So if we look at it, really what I was craving was saturated fats, complex carbohydrates, more quantity of food, things that would really help to create a little bit more of a grounding effect. And the research has really shown that especially people who live in high dry climates, there's a tendency toward having more anxiety, and the rate of suicide is greater in climates where vata is naturally more prevalent. And so it's there that we need to access what's available to us in the land. So eating gamey meats in high dry climates is important to help reduce anxiety in those who are experiencing it. So it doesn't have to be a meat eating thing. It doesn't have to be a vegetarian thing. But when we just start to look at the quality and the quantity of the food that we're eating to help to ground us, and it sounds very simplistic, right? Like, you're up in the clouds, ground yourself. But if you can look at it more from a therapeutic standpoint, the administration and the application of it can be actually quite beautiful.
Interesting.
Great. Well, we're coming up on our time. I want to acknowledge that this recording will be available on ACRM's YouTube channel sometime in the next couple of days. And we get many views, sometimes hundreds of views. Is there a way for people, if they have questions, the people that are watching this, that they could reach out to you?
Yes, absolutely. So I can be found. I have a website that has a lot of resources, and it's Amita Ayurveda.com, and on there's also a place where they can contact me. I do have a clinical practice in Tucson and Arizona and in Durango, Colorado, and I also have I've just written a book called Breaking the Rules Without Breaking the Principles. Can I show that book? Is that okay?
Sure.
So I have just written this book, and it really highlights some of the things that I was talking about today in terms of understanding the individual person and the individual constitution, and the way in which you can start integrating this into your life, not only as a patient, but also as a provider. And so, yeah, feel free to take a look at all of those things. And I do have a contact page as well if there are specific questions you have, whether it's about Ayurveda or providers that you would like to refer to.
Wonderful. Thank you for sharing your experience and expertise. And thank you everyone for tuning in. That concludes this Hot Topics in complementary and integrative rehab medicine. So thank you once again, Amita Nathwani, and to my co-host, Peishan Wen, and all those that are listening.